How did becoming a pediatrician change the way you looked at life?
Profoundly, children are real fighters.
Right.
Even when they go through sickness or illness, you see that profound sense of hope in them.
Right.
They always show that hope is much stronger than fear.
True.
Because we keep saying that children are the future of the nation. So anything with regards to their health or with regards to their family, you know that you can create a very long-lasting impact on the child. That is a privilege very few specialties can offer. And with the families, you learn that compassion can be as good as medicine, as healing as medicine. So these two things are amazing to learn from the child and their family. So on a personal level, I started being more patient, more compassionate,
Right.
and I started spending more time with my family. Because you see children, you see their families, how they spend time.
Yeah.
So I think that has given me a lot of sense of wisdom with regards to how I approach towards my life as well.
Right. Beautifully put. Welcome back to Beyond the Title, a podcast where we go beyond the achievements and designations to understand the person behind them. Every child deserves the healthiest start to their lives, but parenting today has become more overwhelming than ever. Between Google searches, social media advice, family opinions, and endless unnecessary information online, doing what truly is right for our children has become very difficult. Today's conversation isn't just for parents, it's for future parents, caregivers, grandparents, and for anyone who truly cares about the well being of their next generation. We will be talking about childhood nutrition, mental health, Down syndrome, autism, milestones, screen time, vaccinations, parenting myths, and a lot of other decisions that can shape a child's future. We're joined by Dr. Karthik today, a pediatrician who has spent years of his life caring for the well being of children. Welcome to Beyond the Title, Dr. Karthik.
Thank you. My pleasure.
How are you doing?
Very well. How about you?
I'm good, thank you. So, before we dive into your journey in medicine, I'd like to start off with how you got into this field and why pediatrics.
Well, to begin with, my father was a pediatrician.
Okay.
Okay, so he hailed from this place called Siddipet, which is around 80 kilometers from Hyderabad. He was in government service, but basically he was a pediatrician.
Right.
So it was always this bade miya chote miya thing going on at home. So father being a pediatrician, most of my childhood during the vacation I spent in his chamber.
Right.
So with the patients coming in, the next question which would pop was, when are you coming to
True.
replace your father? So that kind of sat in my head for a very, very long time, and I think I grew up with that idea. That is
Right.
one. Second thing, I always thought that, pediatrics and being a pediatrician, you start creating an impact very early in life.
True.
Because we keep saying that children are the future of the nation.
Right.
So anything with regards to their health or with regards to the family, you know that you can create a very long-lasting impact on the child. That is a privilege very few specialties can offer.
True.
So this thing always sat in my head that let me start creating an impact in children as early as possible.
Right. Beautifully put. So, how did becoming a pediatrician change the way you looked at life?
Oh, profoundly, children are real fighters.
Right.
Even when they go through sickness or illness, you see that a profound sense of hope in them.
Right.
They always show that hope is much stronger than fear.
True.
And with the families, you learn that compassion can be as good as medicine, as healing as medicine. So these two things are amazing to learn from the child and their family. And on a personal level, I started being more patient, more compassionate,
Right.
and I started spending more time with my family. Because you see children, you see their families, how they spend time.
Yeah.
So I think that has given me a lot of sense of wisdom with regards to how I approach towards my life as well.
Right. So, what's that one patient story you can't forget?
Well, every child teaches you so many things, but then one thing I would probably, it's for something which is forever etched in my memory, is me treating a child or baby who was just about 550 grams.
Oh.
The child was born around 6 months gestation. The mother potentially could not give birth to another child. So a lot of emotions, a lot of challenges. Imagine treating a child the size of your palm, literally the
Right.
size of your palm.
True.
So many organs fitting in, so many challenges. But then the child now is a 12-year-old.
Wow.
And when he visits my OPD, it gives me a great sense of accomplishment. I think these are something, this is something which kind of infuses so much of encouragement into me
True.
to do more and more.
Yeah. So, of course, this is a very emotionally stressing and draining profession. So, how do you navigate through all of this emotionally?
It is very emotional. It, we kind of find it very difficult to detach from that emotion.
Right.
We get involved so much. I think every profession in medicine, every specialty in medicine is like that. But then, as I said, the way child looks at, even while going through that illness, the way the child looks at that sense of hope is always there. You try to pick up those subtle things from them.
Right.
And I think detachment is very, very important.
Important.
And we need to maneuver that process, and eventually you will get through.
Yeah. So, what do you think worries the new parents the most these days?
Uh, I think most importantly, they all want to be correct and right.
Hmm.
And in the process, they tend to overdo things. That is
Hmm.
what is my common observation. And with the concept of one child, because most
Right.
of the families now have one child
Right.
for many reasons, working parents or financial issues or nobody to look after the child.
Right.
So many factors creep in. Most of them try to be right, and in the process they tend to overdo. They look up the internet, they follow what is given on the internet,
Right.
and in the process they kind of make a lot of mistakes. So my advice to most of them would be to discuss with your care provider about how to go about handling the children. If
Right.
you have elders, seek their advice. I think that goes a long way in rearing a child.
Right. So, what are these commonly made mistakes?
One is looking up to the internet and
Mm-hmm.
trying to follow blindly whatever is
Right.
written there. That is the most common thing. Second thing is not seeking the advice of elders.
Right.
Sometimes I'm not saying that whatever the elders, the information they give is correct, but sometimes they do give very valid information. And kind of sometimes starting your own antibiotics or following the old prescription. That is what
Right.
most of the parents do. They just go to the pharmacy, over the counter. In India, you get any medicine over the
True.
counter, buy the medicine. They have no knowledge about the dosage. They don't have no knowledge about how to give it. They end up doing it, and who is the one who gets harmed in the process? Your own child.
Child.
So
Right.
that is what they need to understand.
So, what's that one piece of advice our grandparents' generation used to give that is still valid today?
Uh, I would say well knit as one family. That is
Mm-hmm.
very, very important, and it goes a very long way in the child's thought process, the brain
Right.
development. Second thing is well nourished home food, which you get, which the elders prepare, which I think the
True.
subsequent generations haven't been able to match up to.
Right.
I think these two factors are very, very important.
Yeah.
Rest of the things, I mean, you need not follow or get into their superstitions or things they've been following as tradition. You're smart enough to know where to draw a line. But
Right.
two very important things: one, well-knit family being together, and providing well-nourished food. I think
Very
these
good.
two are very important.
Is protein deficiency a concern in children?
Oh yes, absolutely. I mean, with today's world seeking most of the children trying to resort to junk food,
Right.
so there is definitely a lot of protein deficiency. What a parent needs to realize is that any child you see who's not able to, match the requirement with regards to age, whether it is his height, protein predominantly affects the muscle mass. I think this is
Mm-hmm.
something most of the parents should remember.
True.
And when the muscle mass is affected, naturally you will have weak muscles, the child not able to do things which he is supposed to do at one particular age, not having a linear growth. So these are some factors which they need to keep in mind. And if there is something like that, it needs to be brought to the attention of the
Right.
pediatrician.
So, how much sugar is too much sugar for kids?
Uh, to put it right across in a very, very simple fashion, under 2 years, no sugar.
Okay.
Absolutely. Beyond 2 or later into the childhood, maximum of, I must say, around 25 grams, which is about 6 teaspoons of sugar, not more than
Okay.
that. This should be the broad guideline.
Yeah. Are health drinks really necessary for kids?
Uh, it is need be, situation demands, yes, but in a broader perspective, no. Most of the children do not need a health supplement because most of these health supplements come with a lot of sugar, and
Right.
sugary drinks are really not good. So there are conditions where you might require child not doing well, the child being a fussy eater, not
Right.
able to taken all the required micro and macronutrients. Those are the conditions, and this should be under the guidance of the pediatrician.
Right. So, what are the supplements that children should take regularly?
Uh, Natural supplements is what I believe in and what I actually promote and advocate as well. All colored fruits and vegetables.
Right.
They have a rich source of vitamins. So that is predominantly what they're supposed to take. And whole fruit instead of a fruit juice, because when you make a
Right.
fruit juice, you end up adding sugar.
True.
So if you do these two things, I think they will kind of match up all the required nutrients.
Right. Are today's children eating real food?
You know that they aren't doing
Yeah.
that because for many reasons, for many obvious reasons, they do tend to resort to junk food.
Right.
For, I mean, multiple reasons for that. You have your peer group eating that. You keep seeing a lot of advertisements where they promote junk food, so fast
Yeah.
food. So I'm not saying it's a bad thing to do, but then probably you should reserve it to maybe once in a fortnight or once a month. I mean, it's very difficult to do that. But if you do that, then I think it goes a long way.
Right. With all the busy lifestyle of the parents, what are the biggest mistakes they're making around food?
Oh, most common mistake is bribing the child. You finish the food, I'll get you a dessert.
Right.
I think that is the most common thing they do. But then I'm not saying you don't validate your child's needs. You should do that. But then you should be firm where you're supposed to be firm. So you can be gentle. A gentle parent can be firm as well.
Right.
But then the most common thing is they don't eat together. I think you eat together, it is really good because
Yeah.
your child generally mimics you, the
Right.
parent. So whatever habits you are inculcating in your child is coming from you. So you
Right.
follow good methods, you follow good habits, the same thing the child is going to follow.
True. So, is screen addiction become a very public health issue in kids these days?
Absolutely. I
Yeah.
think we all know that the answer is a big yes.
Yes.
I won't say screen time alone is an issue, but then the time, the amount
Yeah.
of time, and the quality of screen viewing is something which is very, very important. What the child is viewing on the screen is probably
True.
very, very important. The screen time is absolutely not a detrimental thing, but the amount of time you spend and the quality is what matters.
Does this affect the developing of the brain?
Absolutely. I mean, the child, what happens when you do a lot of screen watching is he does not have the real world interaction.
True.
He's dedicated entirely to the screen.
Right.
Now, what one needs to understand is brain does not develop only on stimulation.
Right.
It needs interaction. What the screen does only stimulates,
Right.
but interaction happens only when you talk. The
Exactly.
real world interaction is what is missing. So excessive screen viewing definitely has got an impact on the child's development.
What worries you the most about this digital childhood?
Oh, well, I mean, social media is a boon and a bane both.
True.
We all know that. So most of these children are leaving a lot of digital footprints about everything you do is there on the social media.
Exactly.
In fact, if you know the news as well, United States has recently come up with a recommendation that they are going to watch the social media of the children when they subsequently want to work or study in the US. All these are going to be looked up to.
That's a very good
Do
initiative.
not leave a lot of digital footprints. You are being watched every moment. Everything you do gets onto your social media and you're being watched. So be very careful about what you're doing.
Are anxiety and depression increasing in children these days?
Oh, yes. Again, it's got to do a lot with the social pressure, the peer pressure. Uh, Sometimes you see that the child is all by himself, working parents, so screen viewing, screen watching, does not have much to do, no interaction with any human. So naturally he's going to get a little depressed. So
Right.
anxiety comes along with that. You know, anything, any small task you give him, there is a lot of anxiety. Because he does not have the confidence whether he will be able to do it or not. So I think parenting is very, very important. You need to keep talking to your child. That one-on-one interaction with the child helps and goes a long way. You know?
Right. So, what are the early signs that parents should notice in their child if they suspect they're going through depression or having anxiety episodes?
Child being all by himself, all to himself, staying
Isolation.
aloof, staying isolated, staying within the room, no social interaction, does not like to be included in a social gathering. I think these factors are easily picked up.
Right.
Most of the parents, you know what your child is doing. You can't just categorize them saying my child is like this. No, there is something wrong. You acknowledge that and bring it to the attention of the pediatrician or anybody, bringing the attention of the family members, elders, let them talk, let them discuss.
Right. How much pressure is actually being put on children, about academics?
A lot of pressure. Everybody
Yeah.
wants to be, the top 10, top 5, top 3. I
Right.
keep telling only one thing to my parents: do not compare your children. Okay,
Yeah.
very, very important. You can have only one first ranker in a class. Not everybody can be a first
Exactly.
ranker. So you need to know where to draw a line. Your child is smart. Let him compare to himself, where he was and what he is after a year. I think
Right.
that is better than comparing the child with somebody else.
Yes.
This
Right.
is what I keep trying to talk to my parents as well.
What do you think is the difference between a shy child and the one struggling socially?
Shy is basically a personality trait. It's like, it's somebody leading a warm up.
Yeah.
Over a period of time, you keep talking, the child will come out of that shyness.
Right.
Socially struggling child, that is a persistent feature. It's not a temporary feature. Shyness is temporary. You talk, after some time, he'll try to get interactive with you. You keep
Right.
talking and he gets interactive with you. Socially struggling child is somebody who's staying aloof, isolated, does not want to talk. So that
Right.
is a more serious problem compared to shyness.
Why are today's generation less active than the previous generations?
Well, again, it's got
Social
to do
media,
with the screen time.
screen time.
I think most of it is with screen time. You eat, you're watching something. Hardly go out, play like
Right.
what the kids in the 80s and 90s were doing. That's one of the main reasons.
Is obesity in children becoming a bigger problem these days?
Absolutely. That's got more to do with lack of physical activity, a lot of screen time,
A lot of junk
a lot of
consumption.
junk, absolutely, a lot of sugary drinks. Anything you take has a lot of sugar in it.
Yeah.
Carbonated drinks, your colas, all these things have sugars. You do not actually calculate them, but when you do, you'll be really surprised.
Yeah. So, what is the role of sleep play in child's development?
Very important. Sleep is very important for the brain to grow. In fact, when the child is born, the first complaint which the parent comes and gives is, my child is sleeping for 18, 19 hours. What they need to understand is that the growth hormone gets produced in sleep.
Right.
So more a child sleeps, the better
The
is for the growth of the
development,
child.
right.
And also for the brain development. The brain needs adequate rest. At the same time, the quality of sleep is what is more important. So I keep insisting, let your child not watch screen at least an hour before going to sleep, because that
Right.
has got a lot of impact. That will tend to play on his mind, and sleep quality will definitely come down if you do that.
Right. So, why do you think there's a lot of recurring viral infections these days?
That's got to do a lot with one, how things have changed over a period of time. You have a lot of viruses.
Right.
2, overuse of antibiotics. For every small illness, every small fever, cold, cough, you start giving an antibiotic.
Antibiotic.
So there is a lot of resistance which is developed, and eventually you will have a lot of viral infections as well.
Yeah. Let's talk about antibiotic resistance. So, how concerned should parents be about this?
Very concerned. One is no indiscriminate use of antibiotic, no over-the-counter purchase of antibiotic. Use it only when recommended by the pediatrician, and most importantly, finish the course of antibiotic.
Right.
4 things.
Yeah. What has changed in children's health drastically over the last decade?
The entire thing with regards to how sick the child used to be in the past and how they are doing right now, how the child, because most of the parents at right on day one, when the child is falling sick or has fever, they bring the child to a pediatrician.
Right.
So you have both extremes. There is somebody who tends to use the old prescription and not take the help of the pediatrician.
Right.
So it has gone both ways.
Are allergies becoming more common?
They are. I think a lot of that has got to do with the pollution, rising levels of pollution. And Indian children as such are known to be more allergic,
Okay.
genetically more predisposed to allergy and asthma both. So that has got to do with your genetic makeup, and pollution makes a lot of difference in this.
Okay. Why do vaccines remain one of the most debated topics even now?
Most importantly, because they're expensive.
Okay.
Okay,
Yeah.
so, and it's a very chronic and a tedious process in the first 2 years of life. Almost every month you need to visit the pediatrician. So I think laziness with regards to administration of vaccination, and yes, they are expensive now.
Yeah. How do you respond to parents who are hesitant to start vaccination?
I tell them only one thing, Vaccination is not to prevent a disease. Vaccination is only to prevent the complications of the disease. It's like I give you a chickenpox vaccine. It's not like a child is not going to get chickenpox.
Right.
I am going to give you the vaccination to prevent the complications of chickenpox. Like it can
Right.
cause demyelinating encephalomyelitis, which is severe brain infection, where your child will not be able to recover at all. It can cause a worsening pneumonia. So I am preventing those complications which are life-threatening. So you might still have a chickenpox which will come and go.
Yeah.
But vaccination is very important. With regards to polio, it is 100% effective. Today is a National Polio Immunization Day today.
Today? Okay.
So it comes in cycles. So today happens to be one such day. So
Right.
polio is very, very important. Like Amitabh Bachchan says, do boons, very, very important.
Yeah. So, what do you think are the major misconceptions about immunity in children?
One, they feel that you do the vaccination, are not going to get the disease. They need to understand that there is something called as active immunity, passive immunity. Active is something which happens when there is a natural infection. Passive is what I'm trying to introduce into your body by giving vaccination. I'm preparing your body by introducing the vaccination. The antibodies are formed. So when I am having the disease, actually, my body is prepared to face that disease.
Right.
That is what you need to remember.
Right. What do you think are the major parenting mistakes that are being made these days?
Same thing. I mean, they tend to miss out on the dates of vaccination. Now, suddenly your child has to go to US or abroad. They'll come now with the vaccination requirement.
Yeah.
But by then, you've lost out on all the vaccinations you're supposed to be given.
True.
They tend to create false records and go. But then they do a blood check there. And if they find that you've done a fraud, then it's a big crime there.
True.
So be very religious when it comes to giving vaccination.
Do you think parents are becoming more overprotective these days?
Oh, yes, absolutely. I mean, most of them have a single child. So, very, very, very obvious reasons, they're very overprotective. And in the process, they do more harm than good. So, anytime you know that overcare, being overprotective,
Right.
you're not letting the child develop that confidence. Even the simple tasks, you kind of do it for your child. So,
Yeah.
when he gets exposed to the real world challenges, he'll find it a little difficult to face.
True.
I'm a parent. I know that I'm very protective about my child. But over a period of time, I have started mellowing down because he started telling me, let me do things by myself.
Yeah.
So you need to take a back seat and let your child keep a watch, supervise them, but take a step back.
Is gentle parenting often misunderstood?
Yes. That's what I said right at the beginning. You know, a gentle parent, as I said, validate your child's needs. Now, I'll give you an example. You've given a child a chocolate. He's asking for the second one.
Right.
So you should tell your child it is okay not to get a second one. Okay. So you can be gentle and firm at the same time.
Right.
It's not like you give in to the demands and offer the child a second one. So we need to understand where to draw a line because you're rearing a child who is actually knows that you will give in to those demands. So you should be very careful.
When do you think a fever should be an emergency?
Well, firstly, what most of the parents do not understand is they touch the child's forehead or body and feel it is warm and they assume it's fever.
Right.
Most importantly, your first aid kit should have a thermometer. So measure the temperature. If it's above 100 degrees Fahrenheit, that is when you need to consider it as fever. So first 2 to 3 days, simple over-the-counter paracetamol can be given. It is based on the child's weight. So you calculate the child, it's mentioned there. So you can look at the label, you can administer. Beyond 2 days, if the child is still continuing to have fever, you need to take the advice of the pediatrician.
What symptoms should not be ignored?
High fever, even if it's day one, especially if it's high fever with chills and rigors.
Yeah.
The child is not able to breathe well. You find that the child's activity has significantly dropped from what it was, or the sensorium of the child. When he's talking to you, if he's blabbering or hallucinating, all these are symptoms which you need to pick up and seek medical attention.
When we say high fever, is it above 103?
It's above 103.
Okay. What's something other than thermometer that all the parents should have in their first aid?
I think basic first aid kit should include your adhesives, your band-aids of different sizes, cotton rolls, betadine, digital thermometer.
Right.
I think this should do.
Let's talk about child development conditions we're seeing these days. Are we seeing more cases of autism, or do you think it's just getting diagnosed better these days?
I think it's a combination of both. We are seeing more cases. Also, the ones who were not previously diagnosed, we're able to diagnose better now. So, because of the increased knowledge among the care providers and the parents both,
Right.
I think we are able to do that.
What are the early signs parents should not overlook?
Any child who's trying to stay by himself, aloof, isolated, somebody who's doing repetitive things, Somebody you ask a name, he will say, my name is something. And he repeats that again and again and again.
Okay.
This is something which, it's the earliest sign. The repetitive behavior is something which is very characteristic of autism. And of course, the staying aloof and staying by himself. All these things are the earliest signs of autism.
How important is this early intervention? Can it can it actually prevent the child from having any further complications?
Absolutely. Early intervention, early detection is the only way you are actually going to treat this.
Okay.
So you need to understand that it is not a disease. I will say that it is a neurodevelopmental difference. Autistic child does not mean he's got a neurodevelopmental disease. There's a difference. It's a neurodevelopmental difference.
Right.
So you're not actually treating the disease or something like that. Early intervention, picking up the early signs and the counseling part and trying to be more with the child is what is going to help the child recover from this problem.
So again, what are the major misconceptions around autism?
First thing that is it is a disease.
Right.
Second thing that you need a lot of medication to treat it. No, it is not like that. Autistic child can be very intelligent. It's about conditioning the child, and first for that to happen, first thing is most important thing is the acceptance from the parent that the child has an issue.
An issue,
Most of the parents do not accept that the child is fine is what they say, but then when he interacts with his peer group, that is when they will be able to pick up. So if your healthcare provider or your care provider says that there is an issue, please acknowledge that, accept it, and then do what is supposed to be done.
Right. Are children genuinely developing ADHD these days?
Yes, they are, because ADHD basically means attention deficit hyperactivity disorder. But when you talk about that, most of the children are inattentive.
Right.
They will not listen to what you're saying.
Yeah.
Most of the children are hyperactive. So you need to know when to understand that there is a problem.
Right.
Okay. So beyond a certain age, okay, if he's doing things which is not supposed to do at one particular age, a parent will easily pick it up. Okay. So because they see other children of that age group. So beyond that particular limit, if he's being very hyperactive,
Right.
there is an issue with the child. So you need to bring this up with the pediatrician, because a pediatrician, when you take the child to a pediatrician for your regular checkups, he will interact with them for hardly 5 to 10 minutes, and probably that is not good enough for him to diagnose. So as a parent, it is important that you give your inputs with regards to how the child is doing at home, for the pediatrician to gather more information.
So what other signs do parents have to consider before assuming that it's just a phase?
As I said, a set limit about hyperactivity. That is one. Second thing is child being very, most of the most common complaint is the child beating up the other children. That is something which is very, very commonly seen in ADHD. Child being very abusive, child being very, beating up the other children. These are the most common symptoms you see in a child with ADHD.
So how can families support children with Down syndrome?
First thing, don't look at it as a syndrome or a
Condition.
disease. Yeah, it is just that your child is subnormal. I will never say them to be abnormal. They're subnormal. They do things subnormally. If I have a child who walks at 9 months, the child with Downs may walk at 18 months. So that is the only thing which is happening. They need to understand that it is only a little delay in what they're supposed to do. That is also. Do not treat them with a lot of, pity. They don't like to be treated with pity.
Yeah.
So you need to understand there is a little lag in what they're supposed to do. That is all.
So let's not talk about the parents, but what do others misunderstand the most about children with Down syndrome?
They feel that most of them feel that their child is mentally abnormal. Most of them. Secondly, they feel that children with Down syndrome laugh a lot. No, they don't. They have the other emotions as well.
Right.
But in general, they're very happy. But it is not like it is a trademark feature on them that they always keep smiling. Two most important things are these.
How important is the inclusion of these kids in schools today?
I think very important. What one needs to understand is inclusion is not an act of charity.
Yeah.
Not just including them in the schools. It's very important to provide support to them, for them to allow to grow with the normal peer group children.
Yeah.
So that, because when you see the other children actually doing things they're supposed to do, the children with Down syndrome also tend to pick those things faster. They're very intelligent, actually speaking. Provided you treat the associated medical conditions like hypothyroidism, you supplement thyroxine, their intelligence levels are very good. That's very important facet of including them into schools.
Okay. What do you think causes these conditions?
Most common feature or associated feature is elderly primary. So that is something which is very important. Above 35 years, first time pregnant mothers need to be screened thoroughly to ensure that the child who's going to be born is good without any issues. So it can be detected early as well. So you will do something called as triple test, quadruple test, where certain chromosomal deficiencies or anomalies can be picked up. And then we put it across to the parent or the going to be parent, and we advise them what are the things to be done. And yes, it can be detected early. And of course, there is a genetic predisposition also. So family, somebody with the Down syndrome, there is a chance that that can recur or happen again with this pregnancy as well.
Right. How accepting are parents these days with these conditions?
Not very accepting, I must say, because it is not very easy, because there are a lot of associated challenges with this. So it's not an easy acceptance.
So, and they still continue with the pregnancy?
We would advise them to continue, because Downs, as long as the issue is not life-threatening for the child, we would advise them to continue. But then ultimately the decision making is by the parents only.
When would it become life-threatening?
There are certain other chromosomal anomalies, like for example, Patau syndrome or Edwards syndrome, where they are born with a lot of other anomalies, like the cardiac anomalies, wherein it can be really life-threatening and challenging. The child may not actually make through the neonatal period itself. That is when we tell them to kind of terminate the pregnancy. But with Down syndrome, we do not do that.
Okay. When should parents stop comparing milestones?
I think right from the start, don't compare your child with others. I think what one needs to understand is milestones, which all the parents talk about, they're only guideposts.
Right.
And it's not a race. One needs to remember this. Always ask yourself only one question: is my child moving forward? That is the only thing you're supposed to do. Or is he stay put at one place, in the sense with regards to milestones? He was able to sit up at a particular age, he's able to stand up, then subsequently able to walk is what we need to assess. That is all.
What's considered a normal variation in a child development?
Variation is something which is the most important characteristic feature in a child development. So if I say that the child starts walking at 9 months, there is a range. He can start walking between 9 to 18 months. So that is a range I give them. So that is a variation. Beyond 18 months, if a child is not able to do it, then there is a problem. So it is not like my neighbor's child has walked at 10 months, my child should start walking at 10 months. No, it isn't. That is not how it works. As I said, the direction of the development is very important, and it has to be a forward direction.
Right. Let's break some myths now. We'll do a true or false kind of thing. Fever is always dangerous.
Not really.
Cold weather causes colds.
It's a myth.
What usually causes cold?
Any viral infection causes cold, allergy causes cold. Somebody at your home, your parent or your brother, your sibling has cold, you tend to catch that cold. That's all.
Right. So sugar causes children to become hyperactive.
Absolutely. It's a fact.
Yeah. Antibiotics cure viral infection.
It's a myth.
Myth? Yes. Okay. Multivitamins are necessary for children.
It can be essential sometimes. If the child is a fussy eater, or if the child is having chronic illnesses, then multivitamins are essential, but not always.
Okay. What's one health habit that could change a family's life if done consistently?
If I would want to pinpoint on one, I would say eat together. It's very important.
Right.
As I said in the beginning as well, that the child tries to follow you. They eat what you eat. So you eat healthy, you practice healthy habits, and without any screen watching, without any mobile at your table side, if you do that, it goes a very, very long way.
What's one thing people are worrying too much about, and one thing people are not worrying enough about?
I think you're worrying too much about trying to be perfect, trying to compare your child with the other child. Stop doing that.
Right.
I think it's very, very important.
Right. One thing they're not worrying enough about.
Again, eating healthy. Not too worried about eating healthy. Most of them are not doing that, unfortunately. I think it's high time you start doing that. High time you start eating healthy and staying fit, devoting enough time to keeping your body physically fit, in good shape. I think it's very, very important.
If there's one advice you want to give to all the families watching this, what would it be?
Stay closely knit as one family. I
Family.
think joint families is something which has kind of
Yeah.
become obsolete now. I think with the available resources, stay together, live together,
Right.
eat together, spend a lot of time with your children, try to inculcate good habits into them. I think these are something which I would talk to, and I would want the parents to pick this thing from this.
Right. So, being a doctor treating thousands of patients, what did it teach you about being human?
Well, so many thousands of children, as I said, children are real fighters.
Right.
They they show that hope is much stronger than fear. This thing is stuck in my head, and being more compassionate, being more empathetic towards your fellow human beings. I think being very patient,
Right.
knowing how to take things easy, being calm. These are something which I have developed as, not just being a doctor, but I want to do this as being a
Right.
good human being as well.
So we'll have one closing signature beyond the title question. So when all the titles, when your profession, the designations, when all these disappear, what would still remain in your life?
A happy, healthy child is something which I dream of, and I would want every child to be happy, healthy, smiling child. I think when I see a child, I tend to forget most of the things. So when I give up on my profession, I would still probably not completely give up on it. But when I tend to kind of take things easy, I would still want to interact with the child and try to be happy as well.
Beautifully put. So thank you so much for your time today, and so glad you could come down here and have this insightful
It is
conversation
my
with
pleasure.
us. Thank you. Thank you
Thank you.
very much.
Thank you.
Today's conversation reminds us that raising healthy children is not just about being perfect. It's about being informed, being present, patient, and willing to learn. Every child is different, every family faces unique challenges. So, even the smallest moments of love make the biggest differences. Thank you for watching us today on Beyond the Title. We'll see you in the next one.